Good morning, folks. Davis County Judge Executive Al Mattingly here. We're doing another live video, live streaming a video regarding COVID this morning. After I give you a report on what's been going on in Davis County, we have some special guests, Dr. Andrea Moore, who is the OBGYN. And I have Dr. Kelley, and you've all met Dr. Kelley before. He's chief of something out at Owensboro Health. I can't remember the exact title, but he knows what he's talking about. Dr. Dufresne, who's usually with us, is out of town somewhere else today. So let's get right in it. You notice that I wore my mask, as I always do when I start. I'm sitting in my office by myself, but I wear that mask to show you that it's very important. That's one of those tools that we have in our toolbox to protect ourselves and our loved ones from the COVID virus. And I've been fully vaccinated, have been since January, or since February, I guess. First shot in January, second shot in February. And according to some of those conspiracy theories that I was just sharing with Dr. Moore, I should be dead by now, but I am alive and well, and don't know that I've shown anything. Well, don't talk to my wife. She'll tell you that I'm always changing, but that doesn't have anything to do with that vaccine. So today, if you recall, yesterday we reported 8 cases in Davis County. As a matter of fact, the entire Grad region reported 9 cases. And Clay Horton, the director of Green River Health, told us to be careful in just taking the information that you get in one particular day. You've got to look at a 7-day average. So today we came back with a vengeance here in Davis County. We have 21 new cases that have been reported. That makes the total number of cases reported, active or COVID cases reported in Davis County at 10,062 cases. Think about that. 10,000 folks in Davis County have had the virus. Unfortunately, 175 of those folks succumbed to the virus. Those are folks that we won't have here with us this coming Memorial Day or 4th of July or Thanksgiving or Christmas of this year. So if you would, just take a moment and let's remember those folks and their families. Thank you. Now, also, one of the things I think it's important to report is, and I don't have the latest update, but this as of yesterday, we have 3 folks currently in the hospital as a result of COVID. So 3 is a heck of a lot better than the 32, 33 that we had back in January and February at the beginning of the year. On the screen right now, you can see a map of the state of Kentucky. You'll see a couple of counties that have reported less than 1 cases. Owen County and Ballard County, most of the time, those are counties that have very small populations. If you look closely, 6 counties out of the 120 in Davis County are now in the red, meaning they have greater than 25 cases per 100,000. Davis County is at 11 cases and the state at 10.66. Davis County at one time had gotten down to 9.4, which moved us into the yellow. We've gotten back up just a little bit because we had a fairly significant increase in number of cases today and then this past Friday. Hopefully we can get it back down. I can tell you that in a meeting with the Lieutenant Governor at Owensboro Health yesterday, and reading the governor's press release, that he has said that once we hit 2.5 million citizens in the Commonwealth of Kentucky being fully vaccinated, that a lot of the restrictions that are in place will be raised. One of those would be curfews on bars and restaurants. Another would be social distancing as well as larger gatherings. So that's a challenge. It's kind of a certain point that we've got to reach. And as the mayor and I talked yesterday and again this morning on an EDC meeting, we would encourage anyone who has concern regarding vaccines and vaccinations to contact their healthcare professional. For gosh sakes, don't go on Facebook and try to find out what's going on, because that's where you're going to find all the conspiracy theorists all those Facebook doctors and virologists and immunologists who are going to spew untruth and misinformation. So talk to the professionals about it. Jordan, let's pop up where people here. This is a very good slide, and I'm pretty pleased with it. We have had 23,403 people fully vaccinated in Davis County. That's 23% of our population. 30.4% of the population older than 18 years of age. But the one that really pleases me is we've had 10,928 folks vaccinated, fully vaccinated. And as a percentage of the population of those who are 65 years of age or greater, that's 62%. Now think about that. 92% of the deaths that occur and have occurred in the state of Commonwealth of Kentucky have been in those who are 60 years of age or older. We've fully vaccinated 62% of those folks. And I think that's probably, I have nothing to prove what I'm about to say, but I think that's probably why we've seen the number of deaths decline over a period of the last 3 or 4 weeks. So that's a good start. We can't let our guard down. So if you're looking to receive a vaccine, if you'll go on Kentucky COVID-19.ky.gov, you will find the vaccine finder, and that vaccine finder will give you over 40 different providers, Owensboro Health being one of the mega sites. But we also have a lot of local pharmacies, family pharmacies, as well as CVS, Walgreens, Walmart, a lot of places that you can sign up. I know that I was talking to Clay Horton, and one of the problems that we're having now is we're getting more vaccine, and we're having a problem making sure that we have sufficient numbers of people to make sure that we use every dose of vaccine. Because once you thaw out a vial of vaccine and open it, you have to use it within so many hours or it spoils, and we don't want to spoil anything. All right, I've talked enough. It's time that we bring in some professionals. Again, Dr. Michael Kelley is with us, and he has been on the show several times. And we have Dr. Andrea Moore. Andrea or Andrea?
Andrea.
Andrea.
Mm-hmm.
She has not been, but we have been receiving questions and comments about the vaccine and pregnancy. And personally, I've had a niece who was pregnant who ended up with COVID. And I had a niece who had just been pregnant and ended up with COVID. So there seems to be, I think, a lot of vaccine hesitancy among women who are pregnant and among those women who are contemplating pregnancy, beginning a family or having another child. And I thought it important that we bring someone who's an expert, an OBGYN, on to this program and just have a conversation. And Dr. Moore, welcome.
Thank you.
So, Dr. Kelley, welcome to you as well, but I suspect you and I are going to just sit on the sideline and look pretty, right?
That's right. A little moral support and maybe some other
you can sit there and look pretty. I have a hard time doing that. So, been a lot of misinformation, and Dr. Moore and I were talking about a lot of misinformation on Facebook and social media about pregnancy and the vaccine. What are some of the latest fallacies that you have heard, Dr. Moore?
Well, I think the most recent one is that getting the vaccine might affect fertility, future fertility, and that has been, that's just completely false. It comes out of a rumor, just like you said, came out of a rumor from Europe, actually, and it was just complete misinformation. But I think our brains tend to go to the negative, so it was pretty widespread. So that's one that I've been fighting a lot lately. The American College of Obstetrics and Gynecology, along with the Society for Maternal Fetal Medicine, or high-risk OB, and the American Society for Reproductive Medicine all recommend that pregnant women, women who are breastfeeding, and even women that are considering pregnancy, consider getting the vaccination. The main reason is that pregnant women can have a more severe case and course than other women that are of the same age. In fact, pregnant women, when they have severe illness, tend to have higher rates of hospitalization, ICU stays, ventilatory support need, and even death. So because we see those severe cases more commonly in pregnant women, they're considered high risk. And so we really want to try to get our pregnant women vaccinated.
Okay. Do you notice, or have you noticed, or is there any evidence out there that pregnancy termination of the pregnancy occurs more often with women who come down with COVID while pregnant?
Yes, that we are seeing some bad outcomes from pregnant women, both with miscarriage and then preterm labor and preterm delivery. Some of that is iatrogenic just from the severity of the illness. But yes, there are some definite pregnancy.
Are you, so we have a lady who's pregnant and she comes down with COVID. Is there a transmission of the virus from the mom to the fetus to the baby?
So vertical transmission, which is what you're talking about, has not been shown to be occurring. There have been some neonates that are born and quickly get sick, but it is not felt that there's vertical transmission.
So I would guess the same would be true of someone who, as an example, would be pregnant, have COVID-19, recover, now has COVID antibodies. Are those antibodies transmitted to the baby as well, or is it the same theory? You don't have that vertical transmission?
No, that's different. In fact, there's a study that's out recently within the last 6 weeks or so that showed that women that were vaccinated could passively pass on the antibodies to the babies through both breast milk and through the placenta. So basically, babies are getting passively immunized from the virus by their pregnant moms. And this is, now it's a small study. Of note, pregnant women and breastfeeding women were not included in the initial clinical trials to show safety, despite the request by ACOG, the American College of OBGYN, to enroll those women. They were excluded, but we're starting to get more data. There's a self-reporting database to the CDC that has 30,000 pregnant women reporting. And then there's a safe pregnancy registry that has almost 2,000 women that they're following very closely. So we are getting actual data, and there are more studies that are being done.
And I started to say, I thought that I'd read somewhere that there were studies being done on pregnant women, as well as those who are becoming pregnant after they've been vaccinated. So, well, Dr. Kelley, I don't want to leave you out.
All right.
So let's extend this down from pregnant women and those who are looking to become pregnant to those folks who are 16 and younger, to children, and whether or not the vaccine is eventually going to go to those kids, those young people.
Sure. So currently there are studies in a small sort of subgroup, the 12 to 16 or the 12 to 15 age group in the Pfizer. EUA for that, or the emergency use authorization, is likely to be forthcoming. And at that point, the decision will be made about immunizing that group, and then they'll move back to a lower age range from there. So, that's going to be the next group. That's 20% of our population. So when we get into this talk about herd immunity, about vaccinating a certain percentage of our population so that this disease goes from being pandemic to endemic, where there's only spot cases, or potentially you vaccinate enough and enough people have been infected that you don't actually have the disease really in small pockets at all. Getting that 20% vaccinated will become important. Now, that's going to be another bar that we're going to have to cross with ongoing information about safety and efficacy. But in the studies for that age range, the original data from the Pfizer group said that was 100% effective at preventing infection in the 12 to 15-year-old age group. So we're looking at being able to stop people from being carriers, from passing it on to other people. And I want to dovetail that with something that people seem to misconstrue out there. There is evidence that this does prevent asymptomatic infections, that vaccinations that prevent asymptomatic infections and transmission. It wasn't studied in that way, but a lot of the evidence, when they checked antibodies and other things after the study, they noticed that more people in the placebo who didn't get vaccine had evidence of asymptomatic infection or low-grade infections versus the people who got actually vaccinated. So I hear a lot about people like, well, it doesn't really prevent the infection, so why would I want to get it? First thing is, it prevents you from getting severe disease, hospitalized, ventilated, and dying. So that's a really good reason to get vaccinated. And the second thing is that you got to look out for your fellow person. So you don't want to be carrying around a low-level infection and then giving it to somebody else that you work with or whatever based upon that decision. And so vaccines do limit your asymptomatic infection, your viral transmission, and then the severity of illness. So 3 very good reasons for me to get vaccinated. And so now that we're moving towards that younger age range where people's argument will be, well, they don't get that sick. There are still kids that get very sick and die. It's a much smaller percentage, thank God, but it does exist. We have to look at how to vaccinate as a community, as a whole, as a civilization here to be able to protect everybody.
It's interesting in what you said, the vaccinating those folks, vaccinating me may help me not or prevent me from passing an infection on to you, or a child bringing it home to mom and mom taking it to grandma and some of the older folks. It's the same thing about a mask. Wearing a mask, it gives me some protection, but it actually protects you more from me transmitting the disease. So folks forget that a lot of times. They like to think in terms of black or white, when you guys know in science in particular, there are a lot of gray areas in there, and there's a lot of information. And I might say that we're 13 months into the pandemic in effect. Learned about it probably a year and 4 months ago. That's an extremely short time to have come up with a vaccine. Now, there are lots of folks who believe that's too short a time, and that's why you shouldn't take the vaccine. What say you to that?
Well, I think a couple things are that mRNA technology for the first 2 vaccines, the Pfizer and the Moderna, has been around for a long time. And the idea behind it is actually complicated and simplistic all at once. It is a piece of harmless or benign code that is injected mRNA into your deltoid, typically, that the macrophages or certain cells in the body recognize and take up, and then transcribe, which is kind of a fancy term with things called ribosomes, the actual fragment of that code into a harmless, benign piece of what really mimics the virus, COVID-19, the SARS-CoV-2 virus. And in doing that, that piece is actually degraded very quickly in the cell. It never goes into the nucleus where the DNA is, so it's not a part of your genome, and it is harmlessly degraded and goes away. And it presents on the surface of that cell, and it creates a reactogenic or an immune response by your system saying, I don't recognize this funny fragment, this benign fragment, but it looks just like the virus. So it tricks your body in some ways, if you want to put it that way, into generating that immune response, and then it just goes away. The actual spike protein that's pointed on the cell, where you see those cartoon images of a circle with the spike sticking out of it like a little porcupine, those things actually go away eventually as well, like all proteins do in the body. So they don't stay around. So this this is a way of generating an immune response. And when people ask about, well, I've had symptoms, I had fevers, I have fatigue after this, that's just your body being reactogenic to this. Most of the reactions are that fatigue, it's your body mounting an immune response. That's an actual positive thing to see, in that your body is mounting a response. So as far as this went too fast and all that, I find this to be, in the first 6 months, I'll admit, I didn't think we would get to the finish line as fast, but looking at all the studies, and initially I might've been somebody's like, I'm not sure. Within about month 9, or probably September, October of last year, I was all on board with getting vaccinated. I felt very comfortable from reviewing the literature, knowing what I know. People worry that somehow that physicians are in some echo chamber, that we listen to a lot of people and a lot of different things and look at it in a very sort of, I think, diligent and scientific way. And I'm very comfortable with the speed in which this happened, in the way in which it was done. And I'm excited about what mRNA may be able to do for other disease states as we move forward as well. So that's a whole, I think you'll find Nobel Prize out of this for somebody somewhere in relation to this. So I'm excited about the technology. I think where we're at right now, where supply actually outstrips demand, is a great place to be, that I didn't think we'd be at either. And I think it is important to try to take people that are on the fence or may have misinformation and move them over to the area where you're much more likely to die from getting COVID-19 from getting the vaccine. The benefit of getting vaccinated far outweighs the risks. The risk that you are seeing out there, even the one that was reported today, is 5 to 6 cases in 6.8 million. That's a 1 in a million chance. You have more likelihood of getting anaphylaxis from a penicillin shot, which is 1 in 10,000, than you do from getting, something from this. So we tend to focus, as Dr. Moore had said, on some of those things, the bad things, and I don't want to downplay them. I don't want to downplay people's fear, but I am not concerned, as are most providers, with the speed with which this vaccine was rolled out.
So what I heard you say is, and I'm going to add some things in there, back when I was a young boy, running around and the polio virus is running rampant. It took a while to develop that vaccine, and the only way that they could elicit a proper response from the immune system was to weaken or kill the polio virus and then inject that protein coating into your body. And now they've learned, a lot of people much smarter than me, learn that you don't even need to inject the entire protein coating. You just inject a snippet of that protein coating, and your body is pretty sharp, pretty smart. Over the millions and millions of years, it's developed a pretty good defensive mechanism on its own. So if you're only getting a snippet, Dr. Moore, how come people just absolutely say that they got the COVID-19 virus from that injection? That's physically impossible, isn't it?
Yes, it is. Absolutely. So, and in those cases, it's usually one of two things, because we see this with the flu every year. I got the flu from the flu vaccine. It's either people misunderstanding that their immune response feels a lot like getting the disease for a short period of time, or especially with the COVID vaccine, some people are becoming infected in between their vaccinations, because it takes some time for your body to build up an immunity. But there isn't a way to contract COVID-19 from a piece of protein that's been engineered in the lab. So, especially one that is degraded as quick as the mRNA is.
And actually what the virus does when your body is invaded by the virus, it actually takes over the cell mechanisms to reproduce itself, and in turn destroys the cell itself, which is what's happening to that's why you get so sick, I guess. So I think what I heard you say, Dr. Moore, is your recommendation to those women who are pregnant or contemplating pregnant regarding getting vaccinated is a resounding yes.
Absolutely.
And if they have concern, you certainly would recommend that they contact their provider, their OBGYN or their healthcare provider.
Yeah, and I think the OBGYN is a great place to go because we're comfortable with pregnancy, whereas other people tend to push away and want to treat pregnant women differently. But all of our big organizations say to treat pregnant women, women trying to get pregnant, and breastfeeding women just like you would anybody else in the population.
Well, I might say that I was very comfortable with pregnancy as well, as long as it was my wife who was carrying the child. So, you know, in the end, everybody's wanting to know what are the long-term effects. And I'm going to ask Dr. Kelley, what are the long-term effects? I know that's a silly question to ask, but I'm going to let you answer it.
Well, I would tell you that between some of the registries that were mentioned and what post-marketing surveillance is kind of, I guess, a term I could use, like people are looking at all the original people in the trials, which go back to June of last year. And we're not seeing signals in those 20 to 40,000 people in each arm of those to have long-term effects from vaccination. And as more time marches on, obviously, we'll see if there's any long-term effects. There hasn't been any cases of transverse myelitis, Guillain-Barré syndrome, or any of the things that have happened with some of the other viruses. Right now, there's a pause on J&J vaccine to look at those 6 cases in 6.8 million that'll be talked about at the Advisory Committee for Immunization Practices and the CDC and FDA tomorrow to decide next steps on that. And so we're taking, even when there's a 1 in a million chance of something happening, we're taking a pause and looking at those and stopping things and deciding what we need to do next. So long-term effects for me always triggers something else in me, that for people who think, well, okay, I'm young and healthy and I'm not going to get sick with COVID to be in the hospital or ventilator or die, because, you know, if we want to say 80-90% of deaths over the age of 65, that's a true statement. But a lot of people are coming back now who've had it, who were never hospitalized, never came to the ER, and they have a kind of milieu of non-specific symptoms. Brain fog, weakness, not able to get back to kind of doing normal things as quickly, these long haulers, which we don't really have a better term for. And so there's also some reason to get vaccinated about the long-term effects of just getting the infection itself. And trying to avoid those things. And so there's even been discussions about people that are long haulers, should they get antibody infusions, even though they've recovered from the diseases? Or what are going to be the therapeutics for people who have long-term sort of simmering effects that are low grade, that don't require hospital? So another reason to get vaccinated from my standpoint, and we're not seeing the people that are getting vaccinated long-term on any mass scale or even a small tick at this point, to tell me that they're coming in and saying, I feel bad or I feel awful. The vast majority of what I'm hearing are positive things from those individuals. Now, time marches on, but most vaccines, if you think about it, we've been doing vaccinations in a lot of different ways for a long time. We've done Ebola 200,000 times or so in the world. This is an adenovector virus similar to the J&J virus, and we haven't seen side effects on pregnancy or long-term or anything like that. So we have to take some lessons from these other vaccines. My expectation is there won't be, but more to come with time.
Well, being physicians, you would know better than most, and that was the point I was going to make. I had a smallpox vaccine 68 years ago, a polio vaccine 70 or 60 years ago. My son had measles, mumps, chickenpox, and all the other vaccines that you have to have before you're allowed to enter school. And there have been no consequences from those. Now, I think you have said, and would be the first to admit, that when you deal in large numbers, millions of people, there can be some effect for a few of those people regardless. I mean, you can, as a matter of fact, you can inject saline into somebody's arm and have a reaction and they'll just pass out. I know, I did, and I'm not afraid of needles. But I forget what they called it, but it was just all of a sudden I woke up and they're tapping me on the cheek. So things can happen, but overall, I think what we have to admit is the effect of the virus is much more deadly than the bad effects that you would have from the vaccine. You mentioned a good point, Dr. Moore. Do you have any preference on vaccines? Which one would you recommend or not recommend? And we've talked about it before, and I do know that the Johnson & Johnson has put on pause for for a little bit, but Moderna, Pfizer, any recommendation? First one you can get?
That's usually what we recommend. Get the vaccine that's available to you. Now, I will mention that very small study that looked at women that were breastfeeding, the Moderna vaccine appeared to have a little bit of a higher rate of the IgA, or the antibody that's used in the passive immunity, than the Pfizer one did. But
Yeah.
I think there's no difference in safety. They're very close in efficacy. Get the one that's available.
Okay. I know that Judy and I received the Moderna. A little bit of a side effect. I had a little bit of a side effect, just a little fatigue. About 24 hours later, was gone in 8 hours. Actually, from my understanding, is that if you have a reaction, that's a good thing, because it's telling you how well your immune system is functioning. And I have heard anecdotal evidence that young folks have more of a reaction to the vaccine than older folks, but that's just because their immune system is probably more robust than someone who's in their 60s and 70s. Real quickly, with young people, I don't think that we've seen any noticeable side effects. They haven't been available for vaccine, or vaccines haven't been available for them. For the last week or so, they've been eligible, anyone 16 and older. So let's talk about who is eligible now.
Okay. So I can't really give you the timeline. In April 5th, it was originally going to be April 12th or yesterday, when the state was going to open to everybody, and then they moved to April 5th. So it became a little bit of a regional thing, and talking to Commissioner Stack on a regular basis, the word that he would give to me was, you're smart enough to figure this out based upon your supply and demand. We had a wait list and that in place. We knew that there were more dots on the map as far as places that could give vaccination. Move ahead when you think you're ready to move ahead, because you think you've done as well as you can in that segment. So we've been open for several weeks. For Moderna, it's 18 and over, and for Pfizer, it's 16 and over, which is one small variation on that has caused a little bit of consternation if you signed up for one site versus another. Our Twin Lakes and Muhlenberg facility do the Moderna. The health department has some Moderna, and also the Johnson & Johnson. And then we, between the health park and here, use Pfizer. And because of the -80 requirements in that, we're really the only one around here using Pfizer, because we have the ability to store it, process it, and operationalize it, as opposed to some smaller pharmacies. So that's kind of where we're at. Anybody who wants to get vaccinated over the age of 16 can get vaccinated within the health system. If you're closer to Muhlenberg and Twin Lakes and you get Moderna, then it would be over the age of 18. And we're not based upon any health conditions at this time. It's not based upon anything at all. It's free access. And signing up for any of those sites that you put up on the site that you had, with I think it said 40, probably within a 25 to 50 mile distance, and signing up for us, going to the Owensboro Health website and clicking on and looking for open slots, of which I know there are open slots next week. And then we adjust every week based upon how many we fill, whether we're going to open full days, whether we're going to ask for another pallet the next week, whether we're going to send another pallet somewhere else. A pallet's about 1,170 doses of Pfizer. So it comes only in that size shipment. So we have to plan ahead, and we want people to come and get vaccinated. If you talk to people who come here and been vaccinated, it's probably as well as the other place out there. It's a pretty smooth process. You're in and out the door in about 45 minutes. 15 of that is watching you just to make sure you don't have a reaction. And if you have a history of any type of reaction to vaccinations, we typically want to watch you for 30 minutes. So I think in general, if you talk to other people who've been vaccinated and you have some concerns or worries about the process, talk to your healthcare provider, talk to somebody that you trust that is good at distilling the appropriate knowledge. Then we have slots available for you to get vaccinated. We don't do nights and weekends right now, just based upon that. So we will get you in and out as quick as we can.
One of the questions that I've had before is, so where online should I be able to go and get trusted advice? And only, the CDC, you can go there and pretty much you can believe what they're putting there. It's going to be scientific. And if you don't have the training, you're going to probably pick up little snippets of things, interpret it wrong, and come away with the wrong impression. Again, I think that what we've talked about here today is it's important that you get vaccinated. The outcomes of COVID, having COVID, far outweigh the downside of being vaccinated. And that if you have any hesitancy at all, please contact your healthcare provider. And I think if we can go away from this with people understanding those things, and it's a personal choice. Nobody is out there demanding and making you do it. It's a choice that you make. But I know I have lost some very good friends who passed away with COVID. I have had some very good friends who are long haulers now, and those outcomes are certainly less disastrous than a sore arm for a little while, or a little fatigue, or an achy joint. So with that, Dr. Moore, Dr. Kelley, thank you for being on with us today. We hope that we have answered some of the questions that the folks out there have had. But in the end, please, I urge each and every one of you, consider getting vaccinated, and with any hesitancy, contact your healthcare provider, and they're going to be happy to talk to you about it. So thank you for being here today.
Thanks a lot, Dick.